one of the most common childhood disorders and can continue through adolescence and adulthood. ADHD has 3 subtypes. Predominantly hyperactive impulsive. Most symptoms, 6 or more, are in the hyperactivity impulsivity categories. Fewer than 6 symptoms of inattention are present, although inattention may still be present to some degree. Predominantly inattentive. Children with this subtype are less likely to act out or have difficulties getting along with other children. They may sit quietly, but they are not paying attention to what they are doing. Therefore, the child may be overlooked, and parents and teachers may not notice that he or she has ADHD. Combine the hyperactive, impulsive, and inattentive. Most children have the combined type of ADHD.
Most of the society is looking for the hyperactive or less attentive child as a child who is lacking the ethics. For that reason, the aggressive behavior of the parents is the usual response to that child, especially the mild forms. The very hyperactive, the family sometimes knows that there is some abnormality, but the mild forms, looking for them as they're lacking the ethics. For that reason, they go for punishment, hitting them, beating them in that way. For that reason, you should understand as a mother and a father, what's the normal child? What's the range of the normal hyperactivity of the child versus the lower or the mild form of hyperactivity as a disorder? There is a change in quality and change in quantity. Sometimes they change just in the quantity, but no change in the quality. This makes the picture so complicated to the parent. For that reason, if you noticed any abnormality, or just you feel that there is some changes in your child, you should call your consultant, your psychiatrist, even by phone consultation. This is one. The problem sometimes that some of the kids, they have hyperactivity very earlier. For that reason, the mother will not understand that this is a disorder, because since the early childhood, very early, even months of age, they have some form of hyperactivity. This is a difficult child, doctor. Since early childhood, he's like that. Sometimes some of the cases are missed. Then they go to the adolescence and they become difficult adolescent. What? They are just adolescent with hyperactivity not treated in the childhood. The problem of hyperactivity when not treated, even those intelligent guys, they will not perform well in their life. Because what? Short span of attention will not make them attentive enough, then they will not concentrate, they will not keep the information, they will not attend enough to grasp the information, they will not keep it, they will not register it, they will not recall it.
Attention deficit hyperactivity disorder actually is characterized by a pattern of diminished sustained attention or higher level of impulsivity in a child that is more than expected given the child age and developmental level. There is 3 types of attention deficit hyperactivity disorder observed. The first one is the inattentive subtype. Inattentive subtype is a common subtype of hyperactivity, attention deficit hyperactivity disorder. We also have the hyperactive impulsive subtype, or sometimes we have combined between the inattentive and or the hyperactive or impulsive subtype. So the 3 observable subtypes that I have mentioned are the most common observable features actually of attention deficit hyperactivity disorder. Either we have increase in hyperactivity or we have increase in inattentiveness, and such issues of course cause significant disturbance for clients with ADHD.
We can find that the main definition of attention deficit hyperactivity disorder or ADHD, that it's one of neurodevelopmental disorders according to the mental and statistical manual of psychological and mental disorder and illness.
Epidemiology of attention deficit hyperactive disorder is important because we began to concentrate in this disorder and the prevalence in children, especially in school age. About 5% of children are suffering from attention deficit hyperactive disorder and maybe more. Also, about 2.5% of adults usually have attention deficit hyperactive disorders, which may gain difficulty in diagnosis and must be differentiated from bipolar disorder and disruptive disorders, personality disorders. Attention deficit hyperactive disorder is more in boys.
Attention deficit hyperactivity disorder is defined as a persistent pattern of inattention and or hyperactivity that is developmentally inappropriate. Some of the features or the symptomatology should be present before the age of 7. Symptoms should be present in at least 2 sittings, and symptoms should be present for at least 6 months.
Inattention, hyperactivity, and impulsivity are the key behaviors of ADHD. Children who have symptoms of inattention may be easily distracted, miss details, forget things, and frequently switch from one activity to another, have difficulty focusing on one thing, become bored with a task after only a few minutes unless they are doing something enjoyable, have difficulty focusing attention on organizing and completing a task or learning something new, have trouble completing or turning in homework assignments, often losing things needed to complete tasks or activities, not seem to listen when spoken to, daydream, become easily confused and move slowly, have difficulty processing information as quickly and accurately as others, struggle to follow instructions. Children who have symptoms of hyperactivity may fidget and squirm in their seats, talk non-stop, dash around, touching or playing with anything and everything inside, have trouble sitting still during dinner, school, and story time, be constantly in motion, have difficulty doing quiet tasks or activities. Children who have symptoms of impulsivity may be very impatient, blurt out inappropriate comments, show their emotions without restraint, and act without regard for consequences, have difficulty waiting for things they want or waiting their turns in games, often interrupt conversations or others' activities.
Attention deficit hyperactivity disorders has two main domains of impairment. One of them, the impairment of the patient attention span and his concentration ability. We can find that the attention span started to be reduced, especially during mental performance or mental tasks. Another thing that we can find, or another domain that you can find, that there is some sort of impulsivity and hyperactivity and some sort of restlessness during communication or during setting to enhance himself for any, or preparing himself to any mental tasks. Another thing we can find in children who are suffering from ADHD or attention deficit hyperactivity disorder, that there is a degree of impairment in learning tasks. While the assessment of ADHD, you cannot able to find a degree of intellectual deterioration. A lot of patients who are suffering from ADHD has a normal IQ on Wechsler-Bellevue intelligence scale and Stanford Binet 5 and 4 edition.
Differential diagnosis from ADHD, the psychiatrist or child psychiatry can be differentiated ADHD from other mental or psychiatric disorder such as psychotic or schizophrenia and bipolar disorder. This disorder characterized by maybe mood elevated or mood swinging and illusion, hallucination, unreality and loss of insight. Can be differentiated from intermittent explosive disorder and mood dysregulation disorder and from oppositional opiate disorder and from drug-induced ADHD as a child complaining from bronchodilators. This child give bronchodilator or isomazid, this drug treatment of TB and thyroid replacement or neuroleptic drugs. These drugs can cause ADHD features.
Diagnostic criteria. There is many signs and symptoms in attention deficit hyperactivity disorders. The most important signs and symptoms that help us to diagnose the children who are suffering from ADHD or attention deficit hyperactivity disorders. One of them, deterioration at attention span, inattentive, poor control of his motor abilities, impulsivity. Perhaps the children who are suffering from ADHD cannot control himself during communication. He always be interruptive to others, fails to give his close attention to details, cannot continue the mental tasks till the end of the point. Also, much more significant point in ADHD, you can find that children much more impulsive and cannot control himself during communicate with others. Perhaps he can forget his schoolwork, may induce some sort of deterioration at learning process or learning performance.
Regarding the differential diagnosis of children or individuals with attention deficit hyperactivity disorder, certain psychiatrists might face a challenge in certain children to diagnose ADHD in them. One of the differential diagnoses that a psychiatrist may encounter with a child with ADHD is that the child might have a mood disorder. Most likely, most commonly, one of the most differential diagnoses that might mix up with the ADHD is the bipolar affective disorder, because they have similar symptoms and might present in the same way to the psychiatrist, and even the parents might see both symptoms as one. For example, the hyperactivity itself in children with bipolar affective disorder in a manic episode, they actually might have hyperactivity, which might be interpreted as a symptom of ADHD, and so the parent or the psychiatrist might think that the child actually has a mood disorder, while in fact he has or she has a ADHD.
We can find some sort of learning disability, especially in math, dyscalculia, and distraction of attention, and the deterioration in social communication functions with children who are suffering from ADHD. And this is an important diagnostic features or diagnostic criteria supporting the main diagnosis of ADHD. But if you want to make and to establish a true and a clear diagnosis of patient or children who are suffering from ADHD, we have some sort of assessment tools such as ADHD rating scale. ADHD rating scale started to assess the ADHD within two levels. One of them is the attention and how much is normal in comparison with other children. Perhaps you found his score in attention domain low in comparison with others. Another domain at ADHD rating scale is impulsivity and hyperactivity. If you found that his score high on the total domains about inattentive and impulsivity and hyperactivity, so he's suffering from a clear degree of ADHD, whether mild or moderate or even severe.
genes, results from several international studies of twins show that ADHD often runs in families. Researchers are looking at several genes that may make people more likely to develop the disorder. Knowing the gene involved may one day help researchers prevent the disorder before symptoms develop. Learning about specific genes could also lead to better treatments. Environmental factors. Studies suggest a potential link between cigarette smoking and alcohol use during pregnancy and ADHD in children. In addition, preschoolers who are exposed to high levels of lead, which can sometimes be found in plumbing fixtures or paint in old buildings, may have a higher risk of developing ADHD. Brain injuries. Children who have suffered a brain injury may show some behaviors similar to those of ADHD. Sugar. The idea that refined sugar causes ADHD or makes symptoms worse is popular, but more research discounts this theory than supports it. In one study, researchers gave children foods containing either sugar or a sugar substitute every other day. The children who received sugar showed no different behavior or learning capabilities than those who received the sugar substitute. Food additives. Recent British research indicates a possible link between consumption of certain food like artificial colors or preservations and an increase in activity.
As regards the attention deficit hyperactive disorder, the etiology is questionable. We first make or get suspicions about the genetic factors, because studies on mono and dizygotic twins find that there is increased risk in monozygotic twins in comparable to dizygotic twins. And also studies noticed that this disorder is running in families. Also biological factors are sometimes responsible in some cases and obvious in some cases, as studies noticed computed tomographic changes and electroencephalographic changes. Also there is increased or dysfunction of adrenergic and dopaminergic tracts. Also psychosocial factors like psychosocial deprivation and disturbed families, great stressors which have a great impact on the personality formation and maturity. And these stressors usually carry a long duration and deep impact on the personality maturation. Also food additives, preservatives, and increased use of sugar and caffeine in youngs may increase the hyperactivity in this child.
A lot of patients who are suffering from ADHD, who cannot continue the treatment or the therapeutic plan, may induce some sort of anxiety disorder at the future, and may also induce some sort of personality disorders. The main personality disorders we can find some narcissistic personality disorders. Narcissistic personality disorders, it means that the patient cannot control his emotions during communicate with people around him. Another thing we can find is that the patient induce anxiety disorders, as I said before, especially general anxiety disorders. General anxiety disorders, it means that the patient has a controlled feeling of fearfulness and a controlled feeling that he cannot able to control his behavior. And a lot of patients, by the way, who suffering from ADHD at the future may induce social phobia, that he cannot able to communicate with people around him, and induce also presentation and anxiety.
Exposure to alcohol and exposure to certain food additives has been estimated to be a causative factor for attention deficit hyperactivity disorder. The nutritional status should be considered when we manage children with attention deficit hyperactivity disorder.
There is no way to start to assessment patient or children who suffering from ADHD without to make a therapeutic plan for enhance his attention and concentration. We have a program to enhance attention and concentration. One of this program is Wisconsin program, some sort of electronic programs that enhance the child to understand and to recall some geometric figures and some digits or some numbers. And these numbers, it's presented or chose to the patient in randomized way. And a lot of another figures show in different colors, by the way. And the patient or the child has to make a recall in what colors and what geometric figures, whether is circles or anything else.
Currently available treatments focus on reducing the symptoms of ADHD and improving functioning. Treatments include medication, various types of psychotherapy, education, or training, or a combination of treatments. Treatments can relieve many of the disorder's symptoms, but there is no cure. With treatment, most people with ADHD can be successful in school and lead productive lives. Medications. The most common type of medication used for treating ADHD is called a stimulant. Although it may seem unusual to treat ADHD with a medication considered a stimulant, it actually has a calming effect on children with ADHD. Many types of stimulant medications are available. A few other ADHD medications are non-stimulants and work differently than stimulants. For many children, ADHD medications reduce hyperactivity and impulsivity and improve their ability to focus, work, and learn. Medication also may improve physical coordination. Stimulant medications come in different forms such as a pill, capsule, liquid, or skin patch. Some medications also come in short-acting, long-acting, or extended-release varieties. In each of these varieties, the active ingredient is the same, but it's released differently in the body. Long-acting or extended-release forms often allow a child to take the medication just once a day before school, so they don't have to make a daily trip to the school nurse for another dose. Parents and doctors should decide together which medication is best for the child and whether the child needs medication only for school hours or for evenings and weekends too.